Welcome to Empowered Health. This week we have an amazing variety of stories with information to help you empower your health.
That's right, we are going to get the lowdown on some cutting-edge research on spinal stenosis. And I'm going back into the kitchen with Julia Olton for some gluten-free cooking.
But first, let's take a look at the amazing health journey of Marco Pitt.
I look forward to seeing Newton every day. And when he's off on his 3 days, I kind of miss him.
Marco is talking about someone who has helped him through a lot of tough times. And that someone happens to be a dog.
Newton and I are a certified team in healthcare. Newton is a canine assisted intervention dog. He's from Pacific Assistance Dogs, and he has been born and raised to help people with disabilities. And in this case, his job is to provide unconditional dog love to the people at the Dr. Peter Center.
I've been at the center now for a year and a half, and I met Newton then, at the beginning. And he's just a phenomenal dog. Like, he just has this era that, that we cut, both of us.
For the past 2 decades, Marco has been living with HIV/AIDS. When he came to the Dr. Peter Center, he met Melissa, whose job is to promote wellness by encouraging patients to participate in activities they enjoy. The idea is to diminish the stress of dealing with illness and build trust. This is exactly what Newton does for Marco.
If they are angry, he's there. If they are feeling upset, he's there. Some people will just put and Marco included, will just put their head with him. It's enabled Marco and I to have a special relationship and improved sort of the bounds of therapy that I can do with him, because it's enabled him to open up about his family history, about his life.
Marco takes Newton out on day trips and gives him an opportunity to socialize. But more importantly, their relationship provides him with an unconditional love and gives him an opportunity to make an emotional connection. The role dogs play in medicine is celebrated in the book Cause and Effect, The Healing Power of Dogs.
Having the dog near someone when they're talking about something that's difficult, and just to have Newton there to provide that solid comfort is amazing. And I've seen that with Marco, and he's really blossomed as he's been able to depend on Newton and have Newton as someone he can love and who loves him back.
And I love that dog so dearly.
Coming up on Empowered Health.
Magnetic bracelets are a very big business. You could buy magnetic straps and belts and even kits to magnetize your water. You go right ahead and do that, because there's no evidence you're going to come to any harm.
You're watching Empowered Health. VJ, I keep hearing about these magnetic bracelets that are good for some kind of health benefit. Do you know anything about it?
Well, not exactly, Michelle. I've seen some commercials. Supposedly, they're good for joint pains. Lucky for us, these magnetic bracelets attracted Randy Shore's attention. Let's see what he's got to say. Randy?
Magnetic bracelets are a very big business. You could buy magnetic straps and belts and even kits to magnetize your water. You go right ahead and do that, because there's no evidence you're going to come to any harm. The fact that these things are sold on cheesy late-night TV ads and websites full of customer testimonials should be enough to get your spidey senses tingling about any claims the manufacturers might make. Someone clearly believes the hype, though. Therapeutic magnet sales top $1 billion every year. A quick scan of the internet will turn up opportunities for you to spend anywhere from $50 to $500. Magnets in joint straps and bracelets are supposed to reduce joint pain by increasing blood flow, oxygenating tissues, or adjusting your body's electromagnetic energy balance. Some claim that magnets have to be on the affected joint, while others claim a body-wide effect from a single device worn on the wrist. Ads and websites usually reference a handful of studies that found patients reported greater pain reduction using magnets than the placebo group. What they usually fail to mention is that the placebo group also reported pain reduction, which suggests that the effect of these devices is either wishful or the result of natural healing. Listen closely. Claims that magnets will reduce pain or inflammation or promote healing in any way are based on bad biased or non-existent science. Writing for the Journal of the Canadian Medical Association, complementary medicine researchers at the universities of Plymouth and Exeter analyzed 29 studies and found no evidence that magnets are useful for pain relief. A slight measurable effect in studies involving patients with osteoarthritis was significant enough to warrant additional research, but that's a long way from an endorsement of quackish TV cures. Even the researchers who obtained measurable results in osteoarthritis trials admit straight up that it's most likely a placebo effect. Here's something that is true. Chronic pain is the most common reason people seek complementary and alternative therapies, and I can totally understand that. But if your pain is not well managed, talk to your doctor before you blow big money on cheap jewelry. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive the appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Carlo Amendolia, who's doing work on spinal stenosis.
The blood supply to the nerves, it's called ischemia, starts to take place where the blood supply to the nerve is diminished because of pressure on the nerves themselves. And this causes numbness, tingling, weakness, and all kinds of different sensations in the legs that inhibit the person from standing or walking for prolonged periods of time.
Spinal stenosis is the most common cause of pain, disability, and loss of independence among older adults. Many different interventions are being explored. This is Dr. Amendolia's approach.
So we've developed this program, it's called Boot Camp for Stenosis. It's all aimed at trying to maximize the cross-sectional area or increase the openings of the spine when patients stand and when they walk. And the reason for that is because spinal stenosis, although there's the structural component, which is the changing of the canal size because of arthritis, there's also a dynamic component to the condition. And what we mean by that is that the symptoms change depending on your body position.
The design of the program combines abdominal core conditioning through various exercises and common spinal adjustment procedures for the lower back to improve strength and flexibility.
So if the patients can get flexibility back into the spine through various techniques that we do in the clinic as well as home, then when they can get when they start to stand, that you might have that able to control that kind of alignment in the spine to maximize maybe just a couple of millimeters, but that might be just enough to allow less pressure on the nerves, more blood supply to the nerves, and minimize their pain and numbness and tingling in the legs, and allow them to walk further with less symptoms and hopefully improve the quality of life.
The program has been running for 2 years with excellent results and is on to the next phase.
But now we have to do a randomized control trial to see whether it actually is effective in comparing it to a control group, which would be usual care.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow with better health outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.
Hey guys, this is your Simple Fitness Tips. My name is Jameson Wolf, and this is Simona Marion. Today I want to talk about which rep ranges to use for your fitness goals. Now Simona, I'm going to get you to start with a bodyweight squat. If you're a complete beginner, I recommend rep ranges between 10 and 15. As your form improves and your joints become stronger, you can venture into heavier weights and decreased reps. Rep ranges between 1 and 3 are called neuromuscular adaptation. This is great for athletes that are trying to lift maximal weights as well as power. Rep ranges between 4 and 7 are great for strength and building size. Rep ranges between 8 and 12 are great for those looking for maximal muscle building as well as tone. Rep ranges between 13 and 15 are good for rehab and endurance. And rep ranges of 15 plus are more suited for cardio as opposed to strength training. All of these rep ranges carry over into each other. For basic fat loss and muscle building, I recommend rep ranges between 6 and 10, but don't be afraid of going lower, and don't be afraid of going a little bit higher either. All right, we'll see you next episode.
after the break.
So the process of laser refractive surgery is now a combination of wonderful, amazing technology that continues to advance and evolve, as well as significant accreditation and protocols and systems as to how we deliver them to people as they come through it.
You're watching Empowered Health. Next up, we're going to check out our reoccurring segments on both dental and eye health.
Then after the break, I'm going to jump into the kitchen with Julia Olton and make an amazingly fresh tabbouleh salad. So stay tuned for that.
We've all seen The Swan, the makeover show where patients undergo cosmetic procedures. People are more interested than ever about fine-tuning but not changing their appearance. These more subtle procedures must be planned with extreme precision. In the past, we used two-dimensional X-rays and images to plan these complex procedures with mixed results. These X-rays and images were compared to ideal proportions, largely based on beauty contestants. Modern three-dimensional imaging can now look at a person's anatomy and appearance in 3 dimensions to allow for the three-dimensional diagnosis and surgical plan. A paradigm shift in this particular field has been developed by Anatomage software, which is called the Table. It is currently in use at Stanford University for the anatomy students. This life-size virtual dissection table allows for the visualization of the human anatomy in 3 dimensions. In our office, we now employ 3D imaging systems that use the same technology for various cosmetic procedures. For example, in the Asian population, it is very desirable for women to have a rounded facial appearance. In the past, the reduction of the angle of the jaw was done by an incision inside the mouth, but it could be very uneven due to the limited vision and the need to eyeball the amount of jawbone to be removed. With these new advances in 3D imaging, this same surgery can now be planned and executed with absolute accuracy. This particular patient wanted a jaw angle reduction, so here we can look at her jaw on a 3-dimensional X-ray, and using the Anatomage software, we can print out her jaw in 3 dimensions to 1/10 of a millimeter accuracy. We can also have the vital structures, like the nerves, printed in a different color so we can avoid them. Here I have the model in my hand, showing the areas of removal and the surgical guide. I can mark the exact areas that will be cut, and I can build a surgical guide that will be used during the surgery to remove the perfect amount of reduction to the bone. This allows for a perfect result in terms of accuracy and evenness of the reduction of the bone.
So the process of laser refractive surgery is now a combination of wonderful, amazing technology that continues to advance and evolve, as well as significant accreditation and protocols and systems as to how we deliver them to people as they come through it.
So what is the process once you decide to get laser refractive surgery? Well, to begin with, it all comes back to the eye exam.
So we go through an exhaustive pre-op analysis. Some people have underlying conditions to do with eye care that they didn't know about, and that's part of normal eye care. And some people have a lazy eye. We don't actually normally treat people that don't have 2 good eyes. And that's all part of the pre-op testing and protocol system that we use going forward.
Rigorous diagnostic testing takes place analyzing the patient's retinal and corneal thickness, cornea curvature, lens clarity, aberrations, as well as checking for health issues like glaucoma and macular degeneration. These tests ensure accurate measurement and avoid complications.
We've fed all that into the pre-operative device that actually does the programming for their particular laser treatment on each of their eyes. So that's all being done on the software side, whilst we're keeping the patient fully informed, with fully informed consent of all the issues that they need to know about ahead of time. They will then have signed off on that whilst we have their digital chip prepared for each of their eyes, which we will put right into the laser, which reflects the same pre-op testing devices electronically that we've got pre-operatively, that will then provide the laser treatment that's customized for each of their eyes.
Before surgery, anesthetic drops are placed in the patient's eyes. Once they take effect, the surgery begins and is completed in about 5 to 7 minutes per eye.
Under the laser, they will fixate on looking at the target. The auto tracker in the laser will make sure their fine eye movements are measured whilst the laser treatment's being delivered. Then we complete the procedure, make sure the flap's back in exactly the right place that we will have created for the LASIK, and we'll sit them up and talk to them nicely and calmly, lie them down for 10 minutes to recover, and then we'll be ready to go home and lie down and take it easy for the rest of the day.
Patients can expect minimal discomfort and begin to return to their lives in the next day or so.
Obviously, they're going to be likely to be good enough to function without glasses and to have good vision.
Coming up on Empowered Health.
So it's a fantastic salad full of all kinds of antioxidants and wonderful things.
This cooking and nutrition portion brought to you by Save On Foods.
She's a registered holistic nutritionist and avid blogger and works with people who want to clean up their dietary habits. She is Julia Alton, and she's on the show today to teach us a new recipe. Julia, welcome to the show.
Thank you very much.
And today we are making?
Today we're making a tabbouleh salad. So it's a fantastic salad full of all kinds of antioxidants and wonderful things. What we need to do is chop a bit of this parsley up and finish that off.
Okay.
And then the other part of this that's a major part is the dressing. So there's we put some olive oil in here and a bit of lemon juice.
Right.
And then we've got some garlic and a bit of salt.
Right.
2 cloves of garlic. And we have a bit of salt here. And some pepper. There's about a teaspoon of pepper, so it really gives it quite a bite with the pepper. And the tomatoes and the other things we've already
It's already pre-sliced, yeah.
Sliced. So, and we mix that up.
And for the quinoa, I quickly want to ask you, what's the proportion of water in quinoa?
Yeah, so the quinoa, that's a good thing you mentioned that. I actually pre-cooked the quinoa. So quinoa, it's basically the same thing as with rice. It's 1 cup quinoa, 2 cups water.
So green onions.
Green onions, and you can put the parsley in.
All of it?
Yep,
okay.
The whole thing. And then the tomatoes, and we need to chop the rest of that tomato up. And the mint, we put you can use fresh mint and you can use dried mint. But if you're using fresh mint, you want about 6 tablespoons of fresh mint, and you mix that in with your dressing.
I think for salads, fresh mint's got a better flavor anyway.
I love fresh mint. And it grows like a weed, so most people can even grow it in their garden or in their planters, because it really doesn't take much to make it happen. So, your dressing is pretty simple. A little bit of garlic and olive oil and lemon juice, and you're good to go. So,
and all those things have got really good flavor as well. That's the best part.
Yeah.
So the tomatoes are ready.
So the tomatoes we can put in here, and then we'll mix all of this up, and then we'll add the dressing. And you can see, certainly you see the
colors popping out. It's all coming together. And all it's waiting for is the dressing, I guess.
And the dressing,
which is going to bind it all together nicely.
The dressing is, as I say, pretty simple to put in here. So just mix that up, and you're good to go. I mean, that's how quick it is.
And this was where you said you need to make it rest for a while so that all the flavors can get absorbed.
Now you have to sit back and say, okay, do your flavor melding.
Exactly. Julia, the salad is all ready to try?
It is ready to go.
Let's give it a shot. I like it. It's actually the tanginess of the lemon, the flavor of the garlic, the quinoa, the parsley, everything comes together really well.
And it's incredibly nutritious.
Yes, I'm sure it is. Well, thanks for being on the show, and thank you for showing us this recipe.
Thank you.
Thank you. We have talked a lot about salads on the show, but one topic we haven't touched so far is salad dressings. Registered dietitian Melissa LeBlanc's here to check that topic off the list as well. Melissa, welcome to the show.
Thanks, VJ.
So tell us about salad dressings.
Well, when it comes to salad dressings, what I usually recommend is putting the bottled salad dressing down and going for the ingredients that are right in your pantry.
Are you suggesting making salad dressing at home?
Definitely. It's easy, it's quick, and a lot of the commercial salad dressings have a long list of ingredients and have added sugar and salt that you really don't need.
That's true, and that really interests me. So how do we get started?
So just get started with a mason jar or any other kind of jar that you have, and you can use it to mix your salad dressing and store it in the fridge, so there's no cleanup necessary.
I like that.
Yeah.
And what's the first step after the jar?
So you want to start with a good quality olive oil, something like extra virgin olive oil, and an acidic base like vinegar or lemon juice.
I actually like to use balsamic vinegar, so that can be used as well.
Perfect. Yeah.
Okay, so that would be the base.
That's the base.
How do you flavor it?
And then you just build flavors from there. So if you're making a Greek salad, for example, add a good squeeze of lemon juice, maybe some fresh herbs like oregano and garlic.
That's beginning to sound quite interesting. What about creamy dressings? Can those be made at home as well?
Definitely. Just use something like plain yogurt or Greek yogurt. Buttermilk works as well, instead of something like mayonnaise or sour cream. And then again, you just build flavors by adding pepper, lemon, garlic.
So you can just make all these salad dressings at home with the stuff that's available in your refrigerator or in the pantry.
Exactly.
Well, thanks for being on the show, Melissa, and that's one thing I'm definitely going to try.
Great.
Thanks.
Thanks.
Well, that's all for this episode of Empowered Health. VJ, I can tell you, as someone who is gluten intolerant, it's so exciting to learn about Julia's gluten-free cooking options.
And I'm telling you, Michelle, those recipes taste just as good as they look. Be sure to keep in touch by following us on Twitter, and we'll see you next time.
Have a great week. Bye.